Oh, hello there. Today, we'll be talking about sleep apnea. Do you know what sleep apnea is? I mean, there's 19 other kids here, but I'm choosing you. Me? Um, it's wrong. How about you, Professor? Do you know what it is? You know what? Never mind, you probably do. So I'll just tell you anyways. Sleep apnea is a sleeping disorder that interrupts a person's breathing during sleep. They tend to stop breathing in the middle of the night because their brain and body is not receiving enough oxygen.
Okay. There's two types of sleep apnea. Obstructive sleep apnea and central sleep apnea. Obstructive sleep apnea is when the soft muscles in the back of your throat collapse during sleep. Central sleep apnea is when the brain fails to send signals to the respiratory control center.
So when you sleep, it's normal for your mouth and tongue and pharynx to relax, but not block your airway. For someone that has obstructive sleep apnea, their mouth and pharynx will relax too much, and the tongue will actually fall back onto the roof of the mouth and soft palate and blocking the airway, and so they'll cease breathing and they'll actually wake up with like a gasp of air to reestablish that airflow. This can happen from 5 to 100 times throughout the night.
Sleep apnea can affect anyone, but it's more common in people who are obese, 40 years and older, large neck sizes, alcohol.
Great.
Smoking. Hey, Payne, smoking's bad for you. What are you doing? And males.
People with sleep apnea have symptoms that include loud snoring, gasping or choking throughout the night, drowsiness, mood swings, decrease in sex, and insomnia.
If a sleep apnea is left untreated, it can cause headaches, depression, diabetes, heart failure, stroke.
Oh, my jaw's been really sore lately. But you know why?
Really? Do you snore at night?
Yes, I do.
Do you feel tired most of the time?
A lot of the time.
Okay. Have you noticed if you stop breathing at night while you sleep?
Yeah, I do.
Alrighty, Pig. I'm gonna have Dr. Durante come in and check you out, okay? And do
Okay.
like an intraoral exam, and she's gonna talk to you a little bit more about it, okay?
Okay.
Alrighty.
Good afternoon, Mr. Lee. The doctor told me about some of your symptoms you're having. I'm just gonna check your mouth and see what I can do for you.
Okay.
Well, Mr. Lee, it looks as though you have some chipped front teeth there and even some missing teeth. And possibly some dry mouth. Do you experience that?
Yes.
So, are you having chronic headaches by chance?
Yeah.
And do you have any neck or shoulder pain?
Yeah, like all the time.
Okay, so I'm actually going to recommend you to a sleep study. The most common sleep study used for diagnosing sleep apnea is the polysomnograph, which is PSG. It records the person's brain activity, the eye movements, their heart rate, also their blood pressure, the oxygen in their blood, the air that breathes through their nose, and their snoring and chest movements.
To treat people with sleep apnea, it is suggested that they exercise 20 to 30 minutes a day to improve their cardiovascular system. Or they can change their sleeping position. If you're sleeping on your back, sleep on your side. Avoid any alcoholic beverage, smoking, and sleeping pills. People with sleep apnea tend to use a breathing device at night called a CPAP, which is a continuous positive airwave pressure machine that relieves nighttime breathing problems by pumping a steady flow of air through the nose. So what happens if my sleep apnea gets severe?
Oh well, for more severe OSA patients, surgery may be needed. So we have tonsillectomy, which means that they're gonna remove your tonsils, and we also have adenoidectomy, which means that they're gonna remove your adenoids.
Okay, you start again.
Okay, I'm ready. You better put a filter in there.
Oh boy. Recording? Are you sure?
I know.
Some people tend to use people with sleep apnea uses a
We can do that, right, Lindsay? Look at the paper. I want to see how your eyes look.
Oh, what's that?
More.
Woohoo! To you.
And what am I gonna say? Like,
It's like smoke is bad for you.
okay.
Okay, wait, take it down.